Hello, everyone, and welcome to another episode of Connect with the Nurse. We're going to talk about some wonderful topics today, and with that being effective patient communication. Those things that you should say and those things that you should not say to your patient. And so, want to give you about 3 tips today. One of the first being introduction, another being communicating, remaining informative, and then the third and last one being ending that shift on a positive note with your patient. So first, let's get into it. Let's talk about introduction. When you first come on shift and you're doing your bedside rounds, however you start your day, you want to always make sure, number one, that you knock on that door of that patient's room. Introduce yourself in the most professional manner, giving that patient your name, letting them know that you're going to be that nurse or CNA that's taking care of them today. Updating that board is key because it gives the patient information about their advocate, that nurse, that CNA who's going to be taking care of them today. And then they can reflect back if they forget who came in to see me this morning or who came in to see me tonight. They can remember, look up on that board, and they will see that staff member's name, the information, the date, and it is helping your patient to stay alert and things like that with what is going on. It helps to walk in that room and know a little bit about your patient's history. That helps your patient to feel much more comfortable with you as the advocate and that nurse, that healthcare worker that's going to take care of them today. Getting report from that other nurse and our CNA who's come in. I heard you were dealing with da 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 da. So I want you to know here's what we're gonna do today. If you're going to be getting any labs, we're gonna get labs. We're gonna run this test. We're gonna do this, that, or the other, just so that they know that you are definitely in the loop with their care and that you definitely know what is going on. Talking the other up on the beginning of the shift, whether it is your colleague ending a shift or your colleague starting the shift. It's like nurse so-and-so is going to be taking care of you today. They're going to take good care of you. And just so that they know, they're excited to have that staff member coming in and look forward to it. A lot of times I found that when we enter into the rooms of our patients and we've given excellent quality care, that patient is literally asking, is this nurse or this CNA coming back today? Because they love to feel loved on. And a lot of times, some of the things that we take for granted is that how long a patient has been in a hospital facility. Sometimes they can spend 2 weeks, even longer, in hospital facilities, depending on what type of facility they're going into. They've been there for quite some time. They're missing family, they're missing events, and they've put their life on hold too to get the best care that they need. And so trusting healthcare workers and us as nurses and advocates for them means everything to the patient. So making them very comfortable, even coming on shift and just making their day. Sometimes they're so happy. It's a one-on-one relationship when we get to love on our patients and give them information, share information, let them know we're in tune with what they're dealing with their medical history and with everything that's going on. Really helps out a lot. Think about that. Have you ever thought and put yourself in a patient's position, like you come into that room? Sometimes over the years as a nurse and advocate, I've thought, oh my God, and you think that you're dealing with a lot. And then you look over here at your patient and you realize everything that they're going through. It makes you even more compassionate for that patient, giving even better care to that patient just because you care as a nurse with what's going on with them, or as a CNA even. Our CNAs are our eyes and ears. I just want to really hone in on that when the CNAs and the nurses. It's so important to have that relationship with your CNA because they're our eyes and ears. They're telling us everything that's going on. They're informing us about that patient, seeing any change in conditions and things like that. And so, like I said, introduction goes a long way. It's a lot that plays into that. You want to grab your CNA, let them know at the start of your shift, hey, we've got this many patients, we've got this much going on. What all do we have going on with our patients? How many blood sugars do we have? What is the orientation status of our patients? Where are we going with that? Make sure that you've also opened up communication with them as well so that they can understand everything that's going on with the patient. And then they know that they can come to you anytime they have anything going on as well. And so want to go on with another tip also. I want to talk about communication. Being informative, always remaining informative with your patients so that they can trust us during the shift. So even if it's something like labs, test results, procedures, questions, we always want to make that time a time to be as informative as we can because they want to know that what we say we're going to stand behind. And so if you don't know as a nurse, one thing we don't want to do is tell our patients, I don't know. It makes it sound like you have no clue what you're doing. That gives your patient anxiety. I don't want this nurse back in the room. Rather than just letting them know, you know what, let me find that information out for you. Or when Dr. So-and-so comes in, I will make sure that he stops by your room and we'll make sure that we've explained everything thoroughly. So you always want to be as professional as possible with your patient and assuring them that we can answer those questions. Even during procedures, assuring them along the way, every step in the process. If you're touching, letting them know what you're doing when you're touching. If it's a Foley catheter, I'm going to be inserting, you're going to feel me touching your inner thigh. Everything that you're going to do. If it's an enema, you're going to feel me touching your buttocks. Make sure you've got a witness there in the room with you. If your patient is okay with that they're comfortable, but that the team has reassured the patient that you do know what you're doing. And that's just super helpful throughout the process with your patients. And then that gets them more relaxed for the procedures where they're able to trust you, depend on you, because they do when they're coming into the hospital. We are, again, their eyes and ears. And so they have really valued and taken value in us to be able to help them throughout the process and give them all that they need as a patient, advocate for them as much as possible, and make sure that we are there to support our patients. One thing I like to hone in on is questions, because a lot of times when patients have questions, they look at us to see how we're going to respond. Family looks at us to see how we're going to respond. Are we polite in answering those questions, or do we try to brush the family off? Keeping in mind that families play a large role in the patient's life. They know the baseline of that patient. They know what's been going on with that patient. They know the history of the patient. And so relying upon them to give us that information is very important. You may get a new admission and you're coming in with your new admit. Family is present and you're saying, get to know them. Find out, what's been going on with your patient. Get the family's involvement. Is this a new onset? How long has this been going on? Is this a long history of it? Is this an acute change, or is this chronic? All of the information that we can get with family will help along the way, because again, we are just learning who this patient is as a new admission. And then if it's somebody who we've had for a while, or a returning patient to your facility, that kind of helps you. Now you know a little bit more about that patient. You've got a little bit more about the history, and you can even better advocate for them, being a resource for them. Again, it's everything in patient care, because the biggest thing that a patient wants to know is, can I trust you? with my care. Especially if they've transferred from facility to facility and then coming into your facility as a new patient. They're nervous, they don't know what to expect. You want to make sure that everything is okay. So those are some key things to keep in mind during your patient care. And then lastly is how you close out your shift with your patient. It's very important how you're closing out your shift, how you're ending your day. On a positive note, don't feel afraid or indifferent about asking your patient, how did I do today? Get their buy-in to the care that you've given. I don't know how it works at some of your facilities, but most facilities, there's surveys that goes out in any facility, pretty much all hospitals today. And so when those surveys go out, it is an opportunity for that patient to get to express everything that they've dealt with. And in expressing everything that they've dealt with, they get to name names. They get to talk about your hospital's processes, your hospital's procedures, the staff as a whole, even all the way to the food, the cafeteria, how the staff treated me. Was I informed during the way? Were they courteous? Did the staff treat me with respect? So let's just remember all of those things when we are dealing with effective communication with our patients. We really want to set the standard as healthcare individuals, and we want to let them know that we are very professional. And number one, we advocate for our patients as a healthcare team members. So just remember day to day when you're coming in, starting your shifts, how well do I communicate? Ask yourself those questions. Have I left any room for improvement? Is there anything I could have done better today with my patient? Or did you get that excellent care with your patient and your patient said, hey, are you coming back in tomorrow? And they want to know if they're going to have that nurse or CNA because you just blew it out of the ballpark. So those are some important keys to keep in mind when you're dealing with your patients and when you're coming in on and off of your shift. So hope you enjoyed today's session and see you back again soon.